Hi, good afternoon, everyone. I'm Dr. Tanmay here from Prime Medical Center, Motor City, Dubai. I'm a specialist pediatrician, and today I'm here with you to talk about how to deal with the after effects of the pandemic, which is going on at the moment. Normally speaking, I would have, I had prepared some material to talk on. So I thought I would speak on that. But luckily for me, my work was made a little easier because I got some around 10 or 15 questions from the registrants who were there. And I thought it would probably be more practical if I take the questions first and answer those because that will cover most of what I wanted to say on this topic in any case. So I'll start straight away without wasting any more time. The first question I have here is what are the symptoms and signs of COVID infection in children and how severe is it? Well, the symptoms and signs of COVID infection in children are not anything different from any other respiratory infection in children. So it can range from just a simple cold and a cough with a mild fever, and then the fever may escalate. There could be a sore throat, a headache, body pain, weakness, loss of appetite. There could be difficulty in breathing, cough, wheezing, any of these things. So it could be just an upper respiratory, or it could include the lungs as well. The severity depends upon how healthy the child is. If in a normal healthy child, the symptoms are not that severe. But if the child has some underlying condition like a congenital heart disease or asthma or is on immunosuppressants or is on steroids or has any other disease like juvenile diabetes, for example, then there are chances that the symptoms can be more severe. The next question is there any current evidence to show that children are at lower risk of COVID infection as compared to adults? No, there is no such clear-cut evidence. If you look at the world data, children under the age of 18 contribute to about 8.5% of the reported cases. The mortality overall seems to be low, unless, as I told you, there are any pre-existing conditions like juvenile diabetes, immunosuppression, cancer, or the child is on steroids or has some cardiac disease. And also it depends upon the viral load, how severe was the infection. And of course, now also it depends upon the variant which was causing the infection in the child. And the next question is, what are the suggestions regarding going back to school and regarding to safety and precautions? Well, there's not much change in that. With the children going back to school, we have not seen so many infections coming from the school per se. Most of the infections of COVID-19 that we are seeing in children seem to be coming because the child has come in close contact with one of the adult members in the house who has contracted the infection. Or it could be that the child has come in close contact, like hugging or touching each other in the school or in the nursery or on the playground or anywhere, who is a known case of COVID infection. But barring that, per se, from schools, we have not seen, from schools, nurseries, daycare centers, we have not seen that many number of cases of COVID infection being contracted from these particular areas. Regarding the safety precautions, that would remain the same. That would mean basically social distancing, not allowing physical contact between children, and the use of face masks depending upon the age group that is there in that particular class, and of course hand sanitization as needed. I'll come to the next question, and that is, what is multisystemic inflammatory syndrome in children? Well, this is one of the more serious forms of COVID-19 infection in children. It was first reported in the UK, and we've seen a fair number of cases even in the UAE. Most of them, of course, get hospitalized because the cardinal symptom of multisystemic inflammatory syndrome is that of hypotension or shock. As the name suggests, it involves almost all the systems in the body. So the heart is involved, the lungs are involved, the nervous system is involved, the kidneys and the liver are involved, the skin, the eyes, all these organs are involved. So the child will have multiple symptoms due to myocarditis, due to inflammation of the lungs. The child will have vomiting, diarrhea, abdominal pain, headache, body ache, malaise, bloodshot eyes, difficulty in breathing, along with, of course, fever, which is one of the most important symptoms and signs of the multisystemic inflammatory disorder. The reason why parents have to be aware of this is because earlier on in the when this was diagnosed, it was not sure whether it was due to COVID or not. When the first few cases were reported in UK, the children presented with a simple gastroenteritis-like picture. And that is why any child, even now during the pandemic in UAE, if the child has vomiting and or diarrhea and or abdominal pain associated with fever, then the parents should bring the child immediately to the pediatrician so that the pediatrician can decide on what investigations to do in order to rule out the possibility of this escalating into a multisystemic inflammatory syndrome. Then the next question is, how long does COVID-19 last in children? The infection does not last any longer or any shorter period than it does in adults. So the rules given by the guidelines, given by the DHA, as far as the child resuming its normal activities, are the same as that of adults. That is a quarantine of 7 to 10 days, depending upon how severe the symptoms were. And then once the child tests negative at the end of the quarantine period, the child is free to move about and attend nurseries or schools or daycare centers and go about his or her usual activities, just like adults do. Now, the other question is, what is recommended to keep students physically distant at school? Well, they are kept physically distant just by spacing out the benches and maintaining a distance of 2 meters. Also, we discourage any physical contact between the students. They're not supposed to touch each other. If they do accidentally, they're supposed to sanitize their hands. If they're above the age of 3 or 4 years, then they should also be encouraged to use masks all the time. Even the use of washrooms should be restricted so that the children don't come in touch with each other or do not touch contaminated surfaces left by the previous child. And it should be kept in mind that, and this I'm saying especially because there has been a surge in the kind of fevers and different kinds of fevers and different kinds of coughs and colds and other infections in children from the school or from the nursery, is that social distancing will help in protecting the children against COVID-19 infection, for sure. But that is because COVID infection largely is transmitted by droplet infection, although there is some evidence to show that there is airborne infection, especially in one study that was done in Australia recently. But having said that, there are many germs which are transmitted through the air itself. So they are airborne infections. You do not require close contact and does not require transmission through droplets. That is because these germs are there per se in the air and they can travel a fair amount of distance. So the children can acquire infection from another child even if the children are at 2 meters distance away from each other and are not coming in physical contact with each other. For example, a simple common cold, which is caused by the rhinovirus or the adenovirus, or a streptococcal sore throat, or chickenpox, measles, mumps, influenza, all these can be transmitted through the air. So although social distancing helps to protect children against COVID infection, it will not necessarily protect them from airborne infections because that anyway they can get from the same class. How long, then the next question is, what are the signs of depression that I should look for in my child going back to school after online schooling? Well, the signs of depression in a child may be more subtle and may be missed by the parents, and therefore the parents have to be alert to signs such as loss of appetite, disturbed sleep, grinding of the teeth, lack of concentration or lack of interest in school or in the studies, deterioration of school performance. All these can be subtle signs that could indicate to you that the child may be depressed. And if the child is unable to come out with his or her problems or his worries or his issues, then it might be necessary for the parents to visit not only the pediatrician, but also maybe the school counselor and if required, the psychiatrist. I would like to highlight one thing here is that we believe that children are immune to the emotional or the social effects of this pandemic. That's not true. Children of today's generation are very smart thinkers. So most of the children who are able to, once the age at which abstract thinking is possible, that is after about maybe 4 or 5 years of age, most children are able to understand and grasp concepts very easily. And their minds are tender. So they have fears in their mind. They have fears that they may lose their parents due to COVID. They have fears that they themselves may be at risk because of COVID infection, or they may have a life-threatening infection with COVID-19. They also have the fear that they hear their parents discussing sometimes that one of the parents may have lost his or her job, or they need to scale down their expenses because there is a reduction in their salary, or they need to move into a smaller house, they need to relocate to a different school. So all these fears in their mind can result in them having depression. So it's important to know what is the underlying cause and then address it accordingly. I'll come now to the next question, and that is, can my 8-year-old child ride the school bus, and what if someone in his class gets sick? Well, this is a genuine and a real concern, and I think most schools have been addressing this by taking extremely good precautions as far as screening of children is concerned. I'm not sure whether they're screening at the level of the school bus, but I do know that at least at the level of the entry into the class, most of the schools are strict in screening the children and making sure that they have no fever. And if they do develop even a small episode of coughing or sneezing, they're usually separated out from the rest of the class, and they are advised by the parents to go to the pediatrician and let the pediatrician examine the child and then certify that they are safe enough to go back to school. So because of this, luckily, at least in the UAE, we've been able to control and in fact, I would say preempt infections due to COVID-19 coming through the schools. And luckily, schools in UAE are fairly safe for children to attend, and likewise school buses. And then the other question is, this is a little longer question. It says, my son is 3 years old and he doesn't talk, but he can sing all the nursery rhymes and he can repeat words after us. He used to talk normally when he was 2 years, but then the pandemic came and we were housebound, and due to that, he used to watch a lot of TV. I guess that's what the parents probably means. But now he's not communicating with us. So please answer this question. Well, the thing is that the parent hasn't mentioned exactly how much the child was able to talk. Was he able to talk maybe 2 or 3 words at a time, construct something like a subject, verb, object kind of sentence, or longer sentences before this pandemic struck us? And in general, if I would like to give a guideline, for a 3-year-old, most children would be able to at least communicate by joining 2 words like a subject and verb, or subject, verb, object, those kind of sentences. Also, they are able to understand everything that is spoken to them by parents or by teachers. They would also be able to recognize their body parts, simple objects in their environment. Many of them would be able to recognize even colors and maybe even numbers 1 to 10, a few of the alphabets. So if the vocabulary of the child is normal, if the child's understanding is good, then probably all that is needed from the parents is to compensate by increasing their input with the child, more communication, more verbal communication with the child. And if this doesn't improve the child's communicative skills within a period of, say, a 1 month or so, then it would be time for the parents to see the pediatrician and see if there are any interventions are needed to improve the verbal skills of the child. So that more or less completes the questions that came to me through the registrants for this particular seminar. So now let me highlight a few points that I had prepared to communicate with during this talk. And that is, what is the aftermath of this pandemic? What exactly has happened to the children here, and what are we seeing daily in our practice? That's what I wanted to share with you. Let's divide this into school-going children and the under 5s and the infants. So let's start with the infants. I think the most important impact that the pandemic has had on infants is that they have not seen the world properly. They see around them human beings who are covered by masks. They do not even recognize that there is a mouth in all adults or all the other people around them. And they will probably find it strange when the day comes when the mask is no longer to be used, and they would probably they might have it may have to even have fear in their mind to see beards and mustaches on people, because they're just not used to this kind of a situation. The other thing is that uh, many of the parents need specific guidance on what kind of weaning foods to introduce, depending upon the age of the child. And these weaning foods change with age. They change at 6 months, 8 months, not 8 months, sorry, 9 months, and again at the age of 1 year or so, depending upon the growth of the child, depending upon the child's protein and energy needs, and depending upon what is the texture of the food that the child would like. Now, for this, they often consult pediatricians, and I have many patients coming to me, parents rather coming to me, who want to know the details of weaning foods. But out of the fear of contracting COVID-19, if they don't visit the clinics in time and don't bring their infants in time for a checkup, then there may be a delay in the introduction of age-appropriate weaning foods, which could lead to malnutrition. And the second thing is, during infancy, the growth is very rapid. It's almost a kilo per month for the first 3 months, and then about half a kilo for the next 3 months, and then about a quarter of a kilo for the next 6 months. So during this period, a monthly checkup is mandatory for the pediatrician to be able to give feedback to the parents as to whether the infant is growing in an appropriate manner or not. So this is one thing that can be lost. Second thing is developmental issues. That is, whether the child's milestones are going according to the schedule or not. Because again, milestones develop very rapidly in the first year of life. And the third thing is, of course, delay in immunization. And even the CDC or the WHO has stressed last year itself that routine vaccination should go on whether or not the pandemic is there or not. And in fact, there is no specific restriction on vaccination, even in a child who has had a COVID infection. There are no clear-cut guidelines even now with the CDC or the WHO as to how many days or how many weeks after a COVID infection should a child pick up the threads of the immunization which was lost due to the infection. Having said that, we do vaccination of all children and all infants, even those who have had a COVID infection. And vaccination against these life-threatening diseases, which we do on a routine basis, should never be delayed in any infant. Then coming to under 5s, this is again a very critical period. As you know, about 80% of the brain development of a child occurs in the first 5 years of life. And so all their intellectual quotient, their social skills, their communicative skills, their verbal skills, all these skills are developing very rapidly at this stage. So it is necessary for parents to visit the pediatrician from time to time as necessary, so that they are able to know from the pediatrician whether the child is developing in a normal manner or not. Also, many of the cases of autism are picked up usually after the age of 1 year. And this can be delayed if there is a delay in the parents visiting the pediatrician for the regular checkup of the child. Besides this, of course, the pediatrician can also assess the physical growth of the child and also check whatever immunization or vaccination is pending, so that these issues also can be covered during the visits. And that is why it is important that these things should not be lost out on because of the presence of the pandemic. Then coming to school children. In school children, we are seeing a lot of health issues because of online schooling. And in fact, that was one of the questions asked by the registrants. What are the risks and the benefits of online schooling versus the normal schooling? Regarding online schooling, of course, the benefit is that the child is protected from COVID infection as long as the household members are not infected. And also it is probably convenient because the child doesn't have to, is not in a scramble in the morning to get ready and to go to school. The child will probably be able to have maybe an hour or so more of sleep and would be able to get up in a relaxed manner, maybe have an early breakfast and then sit at the laptop to attend the online school. But the disadvantage is that schooling is not only about education or imparting of knowledge. It's also about being able to interact and adjust to different personalities, different nationalities of the other school children or other classmates. It's also about being able to adjust to difficult situations in school. And This is how schooling basically grooms a human being. So all children who are doing online schooling would lose out on these social skills and communicative skills that they develop, and the ability to adjust to difficult situations in their life. So that is why the risk is one of not being able to adjust to society if the online schooling is prolonged for a very long period of time. And that is why probably it is better that the parents opt for either blended schooling or attend regular schooling with all the precautions in place so that the child is protected against any infection. The other thing is that school-going children are usually physically active all the time. So except for the time that they're actually sitting on the bench and listening to the lecture being given by the teacher, they are usually physically active. They would move around, they would interact, they would play and all that. So in other words, their physical activity being more than metabolism is maintained throughout the day. This helps them in their bowel function. It helps them in preventing any gastric acidity and also generally helps in their overall growth. Whereas children who are denied of this because of online schooling, they would be at a higher risk of weight gain, of obesity, of muscle sprains, of deficiency of vitamin D, and developing gastric acidity or constipation. In addition to this, online schooling also puts the child at a greater risk or at a greater strain of being exposed to the screen all the time. So they are at a higher risk of developing a refractive error. That means developing the need for glasses. So these children should get a routine eye checkup at least once every 6 months in order to make sure that their eyes are not strained too much because of their not only the online schooling but also the school assignments which are to be submitted online after the school hours are over. So this more or less concludes whatever I wanted to tell you. Yes, there is one more thing that I missed actually, and that is there is a question raised as to what kind of sports or what kind of physical activity can a child do during the pandemic which would keep the child safe as well as keep the child physically active. And of course, there is a very good scope for children to maintain their physical activity in spite of the pandemic being present. And that is what we call non-contact sports. So that includes things like jogging, cycling, swimming, tennis, badminton. These are sports where you don't actually come in physical contact with the other players, but at the same time, it gives them not only the physical activity and the burning of calories, but also teaches them skills. For example, when they're doing formal sports like tennis or badminton, then in that case, it's also about having to learn the sport per se in addition to the physical activity that is involved in it. So this more or less concludes my talk, and I'd just like to go through the questions here. Let me see. Do I need a booster after 2 doses of Sinopharm? Yes, currently it is recommended that you take the booster dose. Ideally speaking, you should do an antibody level to see what is the level of your antibodies, and then you can go on to deciding as to the booster dose. I think the guidelines of that are already there on the DHA website. Then let's see what is the next question. Some children who have underlying health problems like asthma may produce symptoms similar to COVID-19. Should parents simply keep their kids home if the teachers can't tell the difference? No, that's not a reason for keeping the children at home. If the children have asthma, then if it's an intermittent form of asthma that where the child has attacks just like few times in a year or so, these children are not on any long-term therapy like inhalers or anything like that. So they can attend school as usual, and the parents should watch out for any symptoms like wheezing or anything like that. And if that's the case, all they need to do is bring the child to the pediatrician so that the pediatrician can assess and see whether this is just an attack or an exacerbation of the asthma, or it is an intercurrent infection with COVID or any other virus or any other bacteria for that matter. And then they can take it on a one-to-one basis on that particular incident. Let's see the next question. So the kids to 3 years and up need to take vaccination. Yes, I'm not sure exactly as to what is the current availability of the vaccine for which age group. But as far as I know, it is for older children. 3 years may come up sooner or later. As far as I know, at least what I read in the papers today, is that the Sinopharm vaccine is undergoing trial, and I think almost 900 children have been enrolled for it. So currently it is undergoing trial. But I think it will soon be available for children from 3 years and above. Let me see if there are any other questions. Is it safe for a 6-year-old child to wear a mask continuously for 8 or 9 hours at school? Let me put it this way. It is not unsafe. If you're looking at whether it will deprive the child of oxygen, no, that's not likely. As long as the mask is as long as the proper mask is chosen and it is properly used. And as far as any hygiene issue is concerned, make sure that you use disposable masks, disposable surgical masks rather than the reusable masks. Because number one, the reusable masks, how much of filtering they will do of the COVID-19 virus is not known, because there is no standardization of these reusable masks. And the second thing is that there are some hygiene issues, because if the child is sweating a lot and all that, it may cause accumulation of bacteria on the inner surface of the mask. If the child has a tendency to sweat a lot or develop skin infections, it might be worthwhile that the child takes 2 masks along with him or her, uses one in the morning and then discards the other one, and halfway through the school can use another fresh mask. That is one thing. And second thing is that if the child is alone at a particular period of time in the school and not in contact with anybody else, it may be safe to remove the mask temporarily, but that is depending upon what the school authorities say and whether that is possible or feasible or not at that point of time. I think I've answered most of the questions. Sorry. Confirm.
Thank you everyone for watching our today's webinar. It was a great informative session with Dr. Tanmay. For booking an appointment with Dr. Tanmay, you can always book an appointment. You can see the number scrolling at the bottom of the screen. That is 047070999, or you can always book an appointment through our application, that is Prime Health Me app. Accordingly, you can proceed. From here, we'll be taking the session off right now. Thank you very much everyone for watching us. I hope the session was useful, and it will be useful for people who will be definitely watching it afterwards. As we always say, that Prime is all about personalized care. Personally, thank you very much. We'll see you in another webinar. Take care.
Thank you.